Hi, everyone. Welcome to the show. I'm Dr. Nicole, and today we're going to talk about a really cutting-edge topic in the world of autism and other neurodevelopmental disorders, fecal transplant therapy. Some of you may have heard about this, but it wouldn't surprise me if it's a new topic for some of you, as it's a relatively new medically focused therapy for children and adults. It's being used for a wide variety of purposes. And basically what we're talking about is transplanting the feces of a healthy donor into someone with a compromised or unhealthy gut microbiome, with the goal of improving their gut microbiome and overall health and function. And it may sound a little bizarre if you haven't heard about it or learned about it before, but I really believe that this is cutting edge medicine and something that is going to become a really valuable and even more commonly used tool to treat not only many physical disorders, but also mental health issues and neurodevelopmental issues that we see in children in the years to come. So to help us understand this therapy better and to discuss his recent research on this topic in autism, I am thrilled to have as my guest today Dr. James Adams. Let me tell you a little bit about him. He is the director of the Autism Asperger's Research Program at Arizona State University. His research focuses on the medical causes of autism and how to treat and prevent it, including the areas of nutrition, oxidative stress, gut problems, gut bacteria, toxic metals, and seizures. He has published over 150 peer-reviewed scientific articles, including over 40 related to autism. He's also the president of the Autism Society of Greater Phoenix, the president of the Autism Nutrition Research Center, the co-leader of the Scientific Advisory Committee of the Autism Research Institute, and chair of the Scientific Advisory Board of the Neurological Health Foundation. He also has an adult daughter with autism. Dr. Adams, thanks so much for being here. Welcome to the show.
Thanks so much for having me.
So I'm excited to dive into this because I think, as I said, this is a new topic for lots of people, and you're on the cutting edge of this, especially in autism. So let's start out by just explaining to people who aren't familiar with this type of therapy, what is it? How is this done? What is this fecal transplant therapy about?
Yeah, so it's very much like taking a probiotic, except instead of taking a probiotic of a few strains of bacteria, we're taking a probiotic developed from the gut of very healthy donors who have typically about 1,000 different species of gut bacteria. Most of the gut bacteria are very good for you. They provide you many benefits. They produce key vitamins. They help digest your food. They help balance your water. They help promote motility. And also they help prevent the overgrowth of bad bacteria. And so what we do in our study is we investigated a very intensive way to transfer the microbiome from someone who's very healthy to someone with autism who has had chronic GI problems for years. What we do is we first pre-treat with vancomycin. It's an antibiotic that kills off bad bacteria in the gut. We do that for 2 weeks because a previous study showed it was very beneficial at fighting the specific type of bacteria that are problems. And then what we did was we went ahead and then had them fast for half of a day and then did a bowel cleanse, just like you do for a colonoscopy. So really clear them out so there's very little of their native gut bacteria still there. And then we give a high dose of the gut bacteria from healthy donors and then low maintenance dose every day for 7 to 8 weeks. And what we're actually giving is not raw stool as they use for some treatments. We actually work with the University of Minnesota. They developed a process to highly purify it and remove all the waste material. So it's 99%, over 99% just gut bacteria, just like a probiotic.
Mm-hmm. So that's why, it's called in the title of your study, the Microbiota Transplant therapy, because really you're taking the actual microorganisms themselves and putting them in, as compared to maybe the term that, I used earlier, some people are familiar with, which is fecal transplant therapy, where actually you are taking fecal matter and implanting that, right?
That's right. And usually with fecal transplant, the approach is just to do one dose, one time. For people with chronic C. diff infection, which is a really nasty type of diarrhea, it affects 500,000 people in the US each year, kills 29,000 people. MT is incredible. One dose, one time, you have a 90% cure rate from people who were literally dying from severe diarrhea. Can be treated with antibiotics, but often it comes back again and again. When you're treated with C. diff, not only is the cure almost immediate within a few days, it essentially never comes back. It's very powerful, very safe. But we work with a gastroenterologist in Australia, Tom Barodi, one of the world's experts in FMT. He's treated over 5,000 people with FMT, and he treated 9 children with autism. And he found, like with C. diff, one dose, one time was enough. Autism was much, much harder to treat. To treat them every day for 3 months. But when he did that, he was eventually able to greatly improve their GI symptoms. And to his surprise, the parents told him that the autism symptoms began improving too. The children were sleeping better, their language was better, they were better able to pay attention to what the families were saying. On his observations, his treatment, he then guided us in developing our own treatment, and we did that phase 1 treatment study. And if you want me to talk about the outcome of that. So,
yeah, I would love for you to. I want people to hear about what the potential benefits of this are.
Yeah. So using this very intensive treatment therapy for 2 weeks of Vanco and the bowel cleanse and 7 to 8 weeks of a microbiota transplant, what we found is that after about 5 weeks, there was a good improvement in GI symptoms in almost all the patients. 80% reduction of GI symptoms. And these children, ages 7 to 16, had all had these GI problems since infancy, chronic constipation, chronic diarrhea, or sometimes alternating between the two. So they had these their whole life, and within 5 weeks, they were greatly improved or even cured of it. And then their autism symptoms began improving a little bit later. So by the end of the study, there was about a 25% reduction in autism symptoms. And we thought it was great. So we did a 8-week follow-up, checked to see that the results were stable, that the GI symptoms were stable 8 weeks after we stopped treatment. The autism symptoms were stable 8 weeks after we stopped treatment. And even the gut diversity. At the start of the study, the kids were missing several hundred species of bacteria. At the end of the study, they had a normal number of species of gut bacteria. So all looked very good. So we stopped there, published our paper. And then a year later, 3 different families came up to me and said, individually, and said, Professor Adams, my son's doing better than ever. And after I heard that the 3rd time, I said, we need to investigate this. And so we did another small study. We followed up with all 18 of the families. That was one of the great things about it, is that there was very minimal adverse effects, so that all of the participants who started the study completed it, and all were kind enough to be interviewed again 2 years later. So a professional evaluator evaluated them, and we found that most of the GI benefits had continued. There was still about a 60% reduction compared to before treatment. But really interestingly, parent after parent said their child had just slowly, gradually continued to improve. And Dr. Evaluator said that on average, there's a 47% reduction in autism symptoms. So the start of the study, over 80% of our participants were severe autism. At the end of it, only, I forget the exact percentage, roughly 15% were severe, roughly 40-some% were mild to moderate, and 40-some% were below the cutoff for autism. All had some symptoms, but big improvements. And so that was very exciting. This is an open label study with some placebo effect, but I think much of the effect is real. You know, when you're counting number of days someone has a bowel movement, it's hard to have a placebo effect that is affecting your number of bowel movements. So it's pretty hard data, you could say.
It's incredible outcomes, and it really, it speaks to the power of the gut microbiome, right? I mean, we talk about that a lot now, about how the gut is really so pivotal in all the symptoms that people experience, whether it's neurological symptoms, physical symptoms, but wow, does this really speak to it, right? I mean, here you did this treatment where you specifically went in and altered the gut microbiome, and all of these changes in all these different aspects of functioning, and that they continued over a period of time.
Yeah, it was just very, very interesting. And our best interpretation is that by improving their gut bacteria, we were now able to indirectly improve brain function. So now the children were able to learn better. So the treatment didn't necessarily give them new words, but we think it gave them a better ability to learn words, to learn social cues, to learn a better behavior. Really interesting things about the study is that there had been a study 19 years ago which guided us, where they gave vancomycin by itself. That antibiotic by itself, they gave it for 8 weeks, and they found by itself it was able to greatly reduce GI symptoms over 8 weeks, substantially improve autism symptoms. But the tragedy was when they stopped treatment, then those benefits were lost in just a few weeks. So we think it was killing off the bad bacteria. They didn't have the good bacteria to prevent the bad bacteria from growing back. They lost the benefits in a few weeks. Also in that study, they found right at the start, they found that in the first day or two of antibiotic treatment, the kids got a little worse. They had increased activity, usually for just a day, sometimes a few days, and then they got better. In our study, we found the same thing. The thirds of the participants in the first few days had slightly worse irritability, slightly worse hyperactivity, usually for just a day or a few days, and then they got better. And found out it was in the people who had worse of those symptoms to begin with. So our interpretation is that they had more of the bacteria that were causing those problems, causing the irritability and hyperactivity. When you kill them off with the antibiotic, then those bacteria release all their toxins all at once. So you have a surge of the symptoms that they were causing. And then those bacteria are dead and gone, and then you begin seeing improvements. So I think that's a very good clue as to a big part of the problem with these pathogenic bacteria.
It's fascinating, and I like that you're talking about sort of the historical precedent that you went off of for this. And then what I think is so great about what you've done with the 2 studies is that follow-up piece that says, okay, this wasn't just something that in the short term, right after the weeks of transplant that we saw these benefits, but actually well further down the road, and not just that the benefits maintained, but that for many of the symptoms that there continued to be improvement along the way, which I think is really, that follow-up is just great.
Yeah, we would have been just thrilled if the symptoms were stable at that point. To see that improvement was just really exciting. And so that's one thing we're very pleased about. There have been very few long-term studies of effects of microbiota transplant. There's been one other for constipation, showing that benefits mostly remain a year later. And for C. diff infections, once you're treated, you pretty much never have it again. Hope is that these benefits will be long-term. Well, they might need a booster down the road, but so far it looks very good.
And so this really differentiates this from, what people think of with traditional probiotic therapy, where we're taking a capsule or a powder or, those types of things, where I think, as you touched on a few minutes ago, there's a real limit to the amount and the diversity of bacteria that we can get that way, right? I mean, even in some of the most powerful probiotic supplements out there, you're really not looking at being able to fit too many strains of bacteria in those products, whereas you're talking about the thousands of strains that we can populate through this transfer therapy. So, to me, that says why many kids and many people are on the probiotics lifelong. They have to keep taking them in order to have even, minor benefit from them. But what you're saying with the transplant therapy, that it really seems to take hold, and that the body's able to hold on to that. Is that just because once it gets in there, then those good bacteria continue to replicate, and because you've changed the entire environment of, the gut, that those good bacteria can thrive? Is that what's happening there?
Yeah, so we think that's a big part of it. Two of the major changes that we saw is that bifidobacteria went up 4-fold after treatment. It was low in children with autism at the start, improved a fair bit after treatment, and bifidobacteria are commonly used as a probiotic. But also we saw a big increase, 80 to 200-fold increase in Prevotella, which is associated with healthy, fiber-rich diets. And at the start of the study, the kids with autism had virtually none of it, and it went up greatly. So other bacteria that probably changed as well. We need a larger study to see. The bottom line, as you say, is that commercial probiotics are bacteria that grow in milk, in air. They only have typically 1 to 10 strains in them. We're limited to what's been grandfathered in by what grows in milk. But what grows in the gut is very different. Your gut lacks oxygen, so most of the bacteria there are anaerobic. They're actually killed by oxygen. So your gut has of order about 1,000 different species. Kids with autism are missing several hundred. So 1 or 2 species doesn't make a big difference when you're missing several hundred. And the complication is one child might be missing this several hundred, this child might be missing this several hundred. All seem to be missing, we found, was Prevotella, and went up 80 to 200-fold. That's, I think, a big part of what's going on. And then also because we used very healthy donors. A key part of what we did was we had one donor for the initial high dose and a second donor for the maintenance dose. I think that's very important because one healthy person may have this 1,000 healthy species, this other person may have this 1,000 healthy species, but they're somewhat different. When we add them together, maybe we get more like 1,300 to 1,400 species. And in fact, when we looked at the kids with autism 2 years later, at the end of treatment, they had a normal level of bacteria. 2 years later, they actually had substantially more bacteria than typical people. They had a healthier number of bacteria. So we think that it looks very promising. It will be stable for years to come.
And obviously, donor health is such a critical part of this, right? And you read things online, and I see, people talking about stuff of, doing these kinds of things, on their own, and finding donors, and I know there's stuff out there on the internet, but really, I mean, I think it's so critical to stress that if you're going to do this, the health of the donor, making sure that you're transplanting from somebody who really has a diverse and healthy gut microbiome is really important, right?
Yeah, I think that's extremely important because animal studies have shown if you transplant a bacteria from an unhealthy mouse, it can make the recipient unhealthy. So we use a very rigorous screening process. Our collaborators at the University of Minnesota. It's so rigorous, 90% of the general population is screened out. The American Gastroenterological Society has certain criteria. So just like the American Red Cross has criteria for blood donors, we use those same criteria. And then we have a lot of additional criteria to check for GI problems, GI history, to make sure the person has a normal body weight. They're not too skinny, they're not too fat, they're just right. And so by doing that, using super healthy donors, it seems very safe. FDA regulates it like blood, like a drug, so we're still cautious. And so we certainly don't recommend people do this on their own. There's probably some degree of risk. That's why I use this really careful screening process. Good example is my mother received a blood transfusion and she developed hepatitis C from that. And my brother's hemophilia, received a blood transfusion, caught hepatitis C, and it almost killed him. The problem there is we pool blood donations from hundreds of donors to make blood products. Here, we have one donor for one dose. So we're not pooling, and that helps keep it safer. So far, FMT seems extremely safe, but we want to keep it that way by using really careful donor selection.
That's helpful to understand that part of the process. I wanted to ask too, just for people who are wondering about this, the logistics of actually how you do this. So you mentioned like the initial major dose and then the follow-up maintenance doses. Is that through a capsule? Is that what is the actual process of getting these things into the study participants?
Yeah, so in our first study, we tried two different ways. One way was we gave the first dose through a rectal enema,
Mhm.
Children just laid calmly on the table. We had a wonderful physician with a wonderful bedside manner, and we gave them a deep rectal enema slowly over the course of 1 hour. And then the parents carried them prone to the car, carried them prone into their house, and kept them lying down to keep that gut bacteria in them as long as possible. So that was one approach. The other approach was we used in both cases, we're using this highly purified form. It was just a liquid, and drank it down, mixed with chocolate milk or with juice or whatever they wanted to. They just drank it right down like a probiotic. In that case, we gave them a stomach acid suppressant because normally your stomach acid kills off most of the bacteria in your food. But here we suppressed the stomach acid so more bacteria would survive. And then all the maintenance doses we gave orally, just like a probiotic, just a little bit mixed in their juice and with the stomach acid suppressant. And that worked very well. Both groups did well. 90% of the people had a great improvement in GI symptoms.
Yeah.
It wasn't 100%, so we want to go back and work improving that. That first study was our first guess on dosing, our first guess on duration. So now if we have this treatment that's very safe at the dose we're having, and we're seeing 90% of the kids responding, well, now let's try a higher dose. Let's try a longer dose. Maybe we can get to 100%.
Well, and that's one of the things I wanted to ask next is what do you think the future holds for this? So we see that fecal transplant, microbiota transplant have been used now, sort of several different applications. You mentioned C. diff. We're obviously talking about, autism and related disorders. What do you see as the future, both from a research standpoint and a practical treatment standpoint? Where do you see this evolving to?
So the FDA classifies FMT like a drug, and so it needs to go through phase 1, phase 2, phase 3 clinical trials. So we did the phase 1 study, which showed it was very safe. We're now doing a phase 2 study for adults. It's a randomized, double-blind, placebo-controlled study. It's going well so far, although we're running short on money for that. So we're doing fundraising now for that to enroll more people. And then the FDA just announced that microbiota transplant for autism has been granted fast track status. What that means is that the FDA recognizes this is a promising treatment based on our research, and also feels that it's for an unmet need, that there is no treatment out there for the core symptoms in autism, the core these GI symptoms. So this fast track status is very exciting. FDA has been very helpful, but still we need to go through phase 2 trials, and then larger phase 3 trial, 500 to 1,000 people, $50 to $100 million. Then we could get it approved for autism. So it's a few years down the road.
Yeah, amazing. That's wonderful about the fast track status. And now, you're running into the resources, probably both study participants as well as the money to do it. So how can people get involved with this? So I think, we've definitely piqued the interest of many listeners, many families out there who are listeners to this show who have children, either younger children or even adult children who are on the spectrum. Where can people find out more about what you're doing with this? How can people support the studies that you're doing?
Yeah, so if they go to our website, autism.asu.edu, then they can go there, and if they have someone who's 18 years and older, they can get on the waiting list for our study. They can fill out the application. If they're under 18, they can be added to our contact list. We hope to do another study for children in the future, just we need to fundraise for that. And when we do, then we will advertise that to everyone who's on our contact list.
Okay. Wonderful. So I highly encourage people to go to the website to get more information, and also potentially to, if you're eligible, to be able to sign up to participate. Such a need for this research, and the potential for so many millions of people to be helped by what is happening with this. So thank you so much for being here today and for doing such a great job of explaining what this is and the research behind it. Really helpful information. I really appreciate it.
Thank you very much.
All right, everybody, that's it for this episode of the Better Behavior Show. We will see you here next time.